Good day everyone, I am Vince, the moderator for this webinar. I welcome everyone to today's webinar, NPI Registry Portal Changes and Best Practice. I want to introduce our presenter for today, Tammy West. Tammy is the Senior Director of CVO Operation and Regulatory Compliance with the Hardenberg Group. She brings 25 years of experience in healthcare administration and 18 years in medical staff services. I would now like to hand over the floor to the speaker. Over to you, Tammy.
Thank you. We are going to get started. Today's agenda, we are going to talk about important terms and acronyms related to the NPIs website. We're going to define and discuss NPIs. We're going to talk about why you need an NPI. We're also going to discuss the registry portal changes and talk about creating an INA account. We're going to discuss the different INA user types. We're going to walk through the application process, the NPI application process, and then we're going to also discuss some tips for smooth navigation. Okay, for the important terms, NPIs is the National Plan and Provider Enumeration System. So NPIs is the National Plan and Provider Enumeration System. It's a system that's run by the Centers for Medicare and Medicaid Services, otherwise known as CMS. And it actually assigns a unique National Provider Identifier, which is the NPI, to all United States healthcare providers and plans. So some key facts about NPIs: the primary purpose of it is the primary purpose of the website or of the NPIs system is to improve the efficiency and the effectiveness of the electronic transmission of health information. Discuss the fact that the NPI is a 10-digit intelligence-free numeric identifier. Who needs the NPI? So you've got the type 1, the type 2, who actually needs that information? Any individual or organization that meets the definition of a healthcare provider or who engages in standard electronic healthcare transactions needs an NPI number. The NPI is actually, if you are going to submit a claim, the CMS 1500 or the UB04, then you have to have an NPI number, and that number has to be included on that claim. Okay, going back to the NPI enumerator, the term NPI enumerator refers to the entity that handles the National Provider Identifier enumeration process, which is the process of issuing the unique 10-digit NPIs to healthcare providers. So surrogacy for Medicare enrollment is a system that allows a third party, such as a billing or credentialing company, to access and manage a provider's Medicare enrollment information in the PAYCO system. The Identity and Access Management System, INA, it's known as the INA system or IAM system, is a system that provides a single login for healthcare providers and organizations to access multiple CMS online systems, simplifying tasks like enrolling in Medicare, managing your billing information, and accessing the Electronic Health Records Incentive Program. Okay, we're going to discuss the NPIs portal changes now that we've gone over the terms that are most frequently used. Okay, now we're going to walk through the steps to create an INA account. The first thing to do, obviously, you want to register in the Identity and Access Management System, or IAM. Applying for an NPI number. So you can actually go to this website to find the application update form, the NPI paper application form. Okay, applying for an NPI online. Basically, this tells you the steps. You would log into the NPIs website, select the option to apply for an NPI for myself, or apply for an NPI for an organization. To make updates to the NPI record, you definitely want to, you would go to the NPIs website. You're going to log into your INA using your user ID and password. You're going to select the Manage Applications button to view your application. Or if you want to view or make modifications to an application, select the Manage button associated with that record. All right, so we're going to discuss now, and this is the last section, we're almost done, tips for smooth navigation. You want to make sure that, first of all, you gather all of the information, have all of your required details ready before you begin. All right, that is the end of the presentation. Thank you. I really appreciate you guys all joining the webinar. I hope that you found it useful. When you get a chance, do definitely go into the NPIs website, look at your provider's information in there, just kind of look at the different areas and the updates that we've talked about. It's definitely easier to navigate. And also update your provider's information, especially their taxonomy codes if you see that they're incorrect, because that way when other people go in, they're getting the correct information. Again, thank you for joining. I appreciate it.
Thank you, Tammy. That concludes the session for today. Thank you everyone for participating. You may all disconnect now. Have a great day ahead.
Thank you.